This conference will now be recorded.
My dear friends, to all of you, you might know me already. I'm Dr. Rabah, and I'm the main mentor of Part 2 MRCOG course. Would you please introduce yourself? Okay, so guys, I'm just want to know about you more, and you also know about the course. Okay, so we will be all together, in a long journey, because this is our long preparatory course, as you can see, and we'll spend time together. So at least to know, you will know your level of preparation. I only expect that you are still preparing your MRCOG journey. Have you got any reading of guidelines or anything? Okay. Okay, so no problem. Maybe you're not. Okay, so, okay, Dr. Sabah, thank you for our response. No problem at all. No problem at all. Okay, so actually, I would like to introduce you to the MRCOG Part 2, okay, because as you know, you already heard about how this exam is very difficult or deep, require deep knowledge. Okay, so I would like to tell you first about the resources, okay, of that course, of the MRCOG Part 2. Yes, I understand. Okay, so yeah, first attempt, and you just passed Part 1, so you are welcome. Okay, so Part 2 is definitely different from Part 1 at all. Okay, it focuses on the clinical knowledge, but I'd like to tell you something. So even the trainees in the UK, when they join, in the preparation of the Part 2 and join the course, I find them also have some confusion between the practice and the guidelines. Okay, because the guidelines, why a guideline is there? Guideline, it's a guidance, right? So it's something written there, giving the recommendation, show the recommendation of the RCOG based on the highest standard of research and the result of that research, okay? And also from, high quality also studies, okay? So, and observation, sometimes also expert opinion will be there, okay? So the college release a guideline. Okay, this doesn't mean that all the hospitals should follow the same guideline as it is. Okay, it's only a guidance, and all people in different hospital, they will try, okay, to implement those changes or those recommendations in the guideline into the practice. Okay, but still there is some different, okay, policies and protocols in each unit, each hospital. Okay, so this is for even the people who are in the UK, while people who are outside the UK practicing, okay, with all due respect, I know that some of you are consultant already, okay, but this exam is different, okay, from what you are doing, definitely different. Okay, there is some common things, like for example, management of postpartum hemorrhage. This is actually something like it's universal, so all the people are doing the same steps. Management of shoulder dystocia, cesarean section way. Okay, so we are all doing the same practice, but I mean, in the guideline, we don't really follow the same recommendation in our workplace, right? In exam, he doesn't want your own opinion, with all due respect. You want to be a member of the Royal College of Obstetrician and Gynecologist, right? So in order to be member, you have to speak their language, and you have to think like they think, and you have to apply their recommendation, right? So the big mistake, number one, that people follow their own opinion in the answer. This is a big mistake. Or people choose what they think it's correct, which is again a big mistake. Okay, and believe me, it takes from me even in my preparation. Okay, I remember those days so many years back when I've just started the part 2 preparation, and I was there thinking like, okay, I'm good in practice. I have also some medical degrees from here and there, so it's okay. I will go for this exam and I will head this exam and ace it from first time. Okay, then I started to read my own material, okay, that I have used to read before for other medical examination. Even it was actually Irish examination, so it was, similar. This is my first postgraduate one. So no, it was not the same. The material that worked for the Irish membership, okay, and diploma is not the same material that I need for the MRCOG. Then I have attended a course. This is by the Royal College. And in this course, it was like eye-opening for me. And they said, oh, sorry, guys, don't follow any books, okay? You need to follow only the material from the college website. Okay, so you go to the RCOG website and you find whatever there. This is your guidance. This is your source of reading. Okay, this is where you get the information. And what you need to do is you need to apply the recommendation of the college as it is. Okay, why? Because they want to standardize the practice. And what is the meaning of that? They want everyone in every place to do the same thing. Okay, so it will be a standard practice, not because here, for example, Dr. Muhammad, he has this experience and he wants to do the management of the case by his own way. In the other unit or in the next hospital, there is Dr. Raja, and he wants to apply his own way of the management of the case. No, the college doesn't want like that. They want a standard practice. How they will make a standard practice? This is by everyone follow the same recommendation, and everyone should answer according to the recommendation that's given by the college. Okay, so this is really, I think, the first step on the right way of getting this RCOG right, okay, and pass from the first time. If we go, guys, with me to the RCOG website, and still you have time before your exam, okay, don't rush to go to the exam, but make sure that you are well prepared for the exam. Okay, this is the RCOG guidelines, right, from the RCOG website. It's free, okay, and it is there for everyone. Then you need to look to the green top guidelines here. This is the first thing that you need to look for. The green top guidelines, as you can see it, last one was the amniocentesis and the chorionic villus sampling. This is in October 2021. Gestational trophoblastic disease, this was in September 2020. Assisted vaginal delivery in April 2020. Maternal collapse, this was in December 2019. Okay, so I have a list of guidelines here, okay? And I need to know exactly what is written in these guidelines, okay? For example, I will take the gestational trophoblastic disease, okay? Then I need to open it. Here I opened, take me to another website, which is the online library, Willy Library, okay? They are the publisher of the college. So this is the management of gestational trophoblastic disease, and this is the executive summary. So the college has summary by itself. Yes, they have summary. Okay, and it would be a good thing also to read this summary, go through the summary. So starting by the how do molar pregnancies present to the clinician, and they will start by clinicians should be aware of symptoms and signs of molar pregnancy. The most common presentation is irregular vaginal bleeding. This is making exam question, right? Right, so when you're reading a guideline, if you print it out, if you are that person that feel more comfortable with papers, okay, and you would like to print a guideline, or if you are doing by the reading by tablet or something, okay, so you just highlight the important point, okay, and how would you know the important point? If this is your first time you're preparing, it's very difficult to know which point is the important point according to the exam or according to the examiner, right? Is it correct? It will be difficult. You can't know it by yourself. Number one, okay, I will be here to help you. Okay, so will be me. Number two, okay, is the questions. And questions, previous exam question exactly, they are the road mark. Okay, so if I ask if you want to go travel from a city to another city nearby you, can you travel without the road marks? Without a signs on the road? Can you do that? No, of course no. So you will need a road marks. What is a road marks for us? It's the recalls. Okay. So it's important. Yes, it's important. Previous exam questions, previous questions that appeared in the Royal College courses, previous questions that is published in the e-learning resources of the college. Okay, so those are a guidance for us to show us, okay, what is the important point from the college point of view and the examiner point of view, okay, and how we are going to focus on that in our study. Okay, so this is the first baby steps in your preparation, okay, that you read and focus while you're reading on the important points. Okay, so this is makes sense, right? Then with every guideline there will be important tables or algorithm, for example. Okay, so what you need to do, I need you to take out this algorithm or the tables and include this in one box or folder, and I would call that it's a treasure box. Why it's a treasure? Because it's something that whenever you open this, okay, you will find new information. You will find something that to help you and guide you in the exam. Okay, so for me, the treasure box was very helpful. Okay, so I had a folder. In this folder, I had all the important tables, algorithm, okay, in the guidelines and whatever took articles, okay. So I needed to really summarize this. This is away from the notes, away from the summaries, because actually I am that person who studied from the guideline myself, okay, and it takes me a long time actually to do that. But anyway, you have summaries ready-made. Still, you need to extract the tables and the algorithm, okay? We are giving you that in the course, okay, in each topic, but I need you to do your own, okay? It's treasure box. Put whatever you think it's important information for the exam and you need to review it in this treasure box from now. Okay, because it will help you when you get before the exam 1,000 of pages of notes from here and there, and you don't know how to revise all of this in a short time. So the treasure box will help you. This is one thing. Okay, so this is according to the RCOG guideline, which is called the Green Top Guideline. Here, the National Guideline Alliance, okay, which is the NICE guideline. The NICE guidelines Okay, so here, NICE, as you know, that this is the institute, okay, of the making sure that all the people who are practicing in the UK are going to have excellent practice, and they have also, it's like, you know, a guide, national, yes, it's a national guidelines. This is for short. Not all the NICE guideline we need for our preparation, okay? Because simply they are 100 guidelines. So it's never, you can't go through that. It will be very difficult actually, okay? Also, there is some other societies, okay, or colleges that produce guidelines, and you need to know it. Then how would you know that? I'll tell you. Okay, so here, this is the NICE guidelines. Of course, all of this is found on the website, so don't worry, but you should know your resources as well. Because I don't want my candidates to be, you know, just like, okay, giving you these notes and that's it. No, I need you to read and know more. Okay, so now I'm going to the NICE guideline, and in the NICE guideline, okay, how would I know, okay, the related topics for me? There is some topics, okay, and I'm going to give you a list of these, like infertility, like preterm labor, like intrapartum care, like antenatal care. Those are NICE guidelines, which is big guidelines, and they're very important in your study, okay? So you should know the resource of each one, okay? So the NICE guideline, if you try to go through them, you will find them very lengthy guideline, okay? So really, when you go to the NICE guideline, you will see a lot of detail. So a very smart tip that you go to what's called here, can you see NICE pathways? In the NICE pathways, just a click and you'll find all the topic on the medical field, okay? Here from A, B, C, and so on, okay? So here is something like Abortion Act. This is related to us. Acne, of course, not related to us. Abdominal aortic aneurysm, not related to us. So, okay, in obs and gynae, we need the abortion care. So I'm going to look here what is written there in the pathway. And in the pathway, I click and I will find for a woman who's requesting a medical abortion, okay, you should give information and provide support, okay, and what you will do, what you need to put in your mind, okay. So there is medication that you give for the medical abortion, okay, and there is also anti-D prophylaxis and preventing infection, reducing risk of venous thrombosis, offering contraception at the time of abortion, okay. So this is important point, yes. Once you click on a point, you will find it here what's written about this part, okay. So here you will find, for example, anti-D prophylaxis. Don't offer anti-D prophylaxis to women who are having a medical abortion, okay, and include up to and including 10 weeks of gestation, okay, while offer anti-D to the women who are rhesus D negative and having an abortion after 10 weeks of gestation, okay. So you think that this is easy way to study or to read if you want to read?
Sure, sure it is.
Okay, so I'm just giving you keys and how would you read the sources, the original source. So you will find finally that we included everything in the notes, but if you want to read more, because you are at the stage of learning and reading, right? So it's your time. I'm not saying to my January candidate now, read these guidelines, but I'm saying this to you because you still have like 8 months before your exam. So you still have time. You can still read here and there and know more information. It will be interesting as well. Okay, so for example, I need to here click on the diagnosis and management of preterm labor. What I find diagnosis here. He will give you how you will do the diagnosis. Okay, what is the recommendation? So, for example, he will tell you, okay, about if the result of the insulin-like growth factor binding protein 1 or placental alpha microglobin 1 test are negative and no amniotic fluid observed, don't offer antenatal prophylactic antibiotic. Okay, explain to the woman that it's unlikely that she had PPROM. In the exam, you will find the choices is the same, in the same language written by the guideline, especially here from the NICE guidelines, the NICE pathway. Okay, so this is one of the secret, okay, of giving course to people, that I prepare my materials from here. Okay, and I'm sure that a lot of mentors who are doing courses, they are preparing their material this way. Okay, why I'm giving you these secrets? Because simply you will need that for the exam. Okay, you need to read the same language and you need to know the original resource. Okay, so here, for example, if in a woman reporting symptoms suggestive of PPROM, offer speculum examination to look for a pooling of amniotic fluid. So now you know that the first action is to offer a speculum examination, right? Then if the pooling is observed, don't perform any diagnostic test. So simply, like in EMQ cases, very easy EMQ, but still candidate can miss that. A woman came with reporting, okay, a gush of fluid, bare vagina, okay. Then you have examined the hair by the speculum examination and you have seen a pool of amniotic fluid. Okay, then he will give you other choices. One of the choices is to perform an insulin-like growth factor binding protein 1 test. Or the second one is offering her antibiotic. So what do you think the correct answer is?
Okay, that would be offering antibiotic because it is already diagnosed. No need to do more tests.
Yes, correct. Yes, correct. So the lady had the speculum, okay, and by the speculum we have seen the pool of the amniotic fluid. Then no need to do anything else. No more tests are required. Just offer the antibiotic. Okay, so simply this is how you answer in the exam, and this is how the cases comes. Okay, so this is the secondary sources of your exam, the NICE guideline, then the green top guideline. Okay, and then I will come to the TUG articles. Okay, and you know that the TUG articles, they are paid. Okay, so you have to pay in order to get the TUG articles. And also the obstetrician gynecology, actually, I would like to say it's very large. Okay, and it's more than 280 or maybe 290 article. Okay, some of them are related to our level of practice, some of them are advanced than our level. Okay, some of them are covered already by the guideline. Like for example, you have to article on preterm delivery. Okay, thank you very much. We have our guideline and we will follow the guideline. We will not follow the TUG article in this case. Okay, so do I need to read all the TUG articles? Okay, so this is the obstetrician and gynecology. Okay, and this is, for example, the volume 22, issue 2, okay, in April 2020. Okay, so do I need to go through all the TUG articles? The answer is no, you don't need to go. Okay, so I've heard some people on the groups on the Telegram or Facebook saying you need to read at least the 3 last years of the TUG articles. Those are the important 3 years. That's mean, okay, doctor, I will read the last 3 years and that's it? The answer is no. Still, your exam contain information published in TUG article 20, maybe 27, 2007, 2010, okay, 2014, 2013, Okay, so oh my God, that's mean that they need to go to all years on the TUG articles. The good news is no, you don't need to go. So means that Dr. Rabah says the TUG articles are not important. No, I didn't say that. I have just said that you don't need to go and read all the TUG articles, right? This is what I have said. If you are interested to read one TUG article, or like, for example, okay, I am so interested in the recurrent urinary tract infection, okay, so I'm going to read that, then it's fine, okay, it's all yours, read it, no problem. But in the course, what I'm doing, I focus on the TUG articles that are important for the exam, TUG articles that properly appear as an EMQ for you. Okay, so that's mean the TUG articles will be selected TUG articles. Okay, so to be honest, I have a very good success rate, alhamdulillah, in my course. Okay, so more than 90%. In the last 3 batches, it was 95%. Okay, so I have never, okay, said all the TUG articles to people, really. Okay, because no human brain it will be able to get all this information. Be smart, study smarter rather than hard. So focus on the important TUG article. Like for example, there is TUG article, very famous TUG article about headache. Yes, this TUG article at least, okay, I am explaining it in detail to the candidate. Plus, in the revision, you will see me repeated once or twice or 3 times at least, because they will go and get EMQ on headache. The TUG article of skin eruption in pregnancy, this is a very important TUG article as well. So this is one that we need to study it in details. The TUG article of perioperative management of women on oral anticoagulant and antiplatelet agent. This is a quite tough TUG article and need to be studied also in details. Okay, and so on. So some TUG articles are really important. Okay, and some TUG articles will be like, okay, it's fun. If you want to go and read about it, then it's fine. Otherwise, no, we will not cover it all the TUG article one by one in the course. I cover only the important one, because I believe, okay, in your exam, if we speak about the resources, that will be like 70% comes from GTG and NICE guidelines. Okay, so this one I need you to do it in details, and I need you to read it and to be very aware of every detail of each guideline, okay, in the GTG and NICE. 10% will come from TUG articles, okay, and 10% will come from other guideline, which I'm going to cover it now, okay, and 10% actually it will come from strategy resources. And this is according to the part of teaching or workplace assessment. It's very related to the practice of the UK. There is no guideline to cover it, okay, only strategy would be there. Okay, so what I'm going to do in the course, I'm covering all the GTG and NICE guidelines, the 70%. I'm covering the strategy, okay, research, teaching, and workplace assessment. I'm covering the 10% of the other guidelines, okay, which is the Faculty of Sexual and Reproductive Health guideline. This is, I'll come to it, a BASH guideline for the sexual transmitted disease, okay, and from the TUG article, I'm covering the important TUG article. Okay, so this is how we do in the course. So 70% of our study will be, again, guidelines, the college guideline and NICE guideline, 10% for the TUG article, 10% for the other guidelines, and 10% for strategy resources. Okay? You don't need to subscribe to the strategy because already it's the information there is summarized in the notes. So, what other guidelines, by the way? The other guidelines are the Faculty of Sexual and Reproductive Health guideline and the BASH guideline. Okay, some guidelines also comes on the oncology part as well. Okay, so what I'm doing in the course, what I need you to do is only study the notes provided to you, because this is a very large guidelines, very big in size, and you will never complete it by yourself. Okay, and actually you don't need to go and read it by yourself. So for example, here, this is the Faculty and of Sexual and Reproductive Health Guidelines. Okay, this is about all the methods of contraception. If you go through it by yourself, it will be like 900 page of information. We had a summary for them, okay, and it's provided to you. So study the summary and it's more than enough. Badge guideline, okay, this is the same. This is the, you can see here, this is the logo of the BASH guidelines, and this is about the sexually transmitted disease, okay, BID as well. So what we do is simply summarize it for you along with the important point for your exam, and that's it. You don't need to go to the BASH guideline, to the website itself. Okay, so this is will be the material will be more than enough in this matter. Okay, my dear friends, clear so far about how the exam? Yes, okay. So this is the website, and in your subscription, you will find in the dashboard, okay, everyone check here your dashboard, okay? So this is the dashboard, for example, okay? And in the dashboard, they will give you the courses that you are subscribed in, okay? So this is called your dashboard. What you will get by your subscription to the course, and I think, my dear friends, you have already your dashboard updated, okay? So you will get the MRCOG Part 2 preparation course in July, okay? This is still almost empty, okay, because we will upload the resources after each session within 24 hours. Then you will get this course, okay? This is the Part 2 question bank and mock exams. So this is something that you will get by your subscription. Make sure that you have access to it. And also it is, you know, I always divide the material for part 2 into modules, okay? So here you will find the pre-malignant lesions, oncology, gynecology problem, urogynecology, and so on, contraception and sexual health, and so on. What you need to do if you want to like for example, have a gynecology problem mock test, okay? You just click here, okay, and you will start your attempt, okay? Here you will see the number of the questions, and here are the questions there. You need to finish them and submit, and you will get your mark finally, okay? Some, most actually of them, they will have time bounded, means time limit. Some of them does not have time limit, okay? So you will have both of them, but you need to practice all within time. So that means you will be able to finish 100 questions in 3 hours. This is the same for the exam. Okay. Another thing, another courses that you will have for free, okay, by your subscription is the September 2021 Success Camp. This is one completed course, finished already, okay, but you still get the material of that course and the recording. All the red icons here represent what? Represent a file, okay? This is a PDF file. All the blue icons here represent a record, okay? This is for a record. Like for example here, okay, if you want to click something like the surgery, this is one of the, this is our next session, I think. Surgery according to your schedule, okay? So here, this is starting by the important topics in surgery module, okay? It will be written here. And then this is important point in the surgery. You can review it, review these notes before your course, before you start the course. And also there is even previous record to the surgery module and post-operative and surgery revision. If you have time and you are so enthusiastic, okay, you can go through the important topics and you can listen to the record, okay, before your own session. I think no harm from that. Okay, this is to help you really. I'm just giving you this access to the previous course materials. So whenever you have time, according to your own schedule, okay, and you want to read ahead or study ahead, you can go through that. Okay, so this is important, also preparatory step for you. Okay, so this is what you get from the course subscription. These are the 3 parts or the 3 courses that you should get. Again, the question bank, the September Success Camp, and your own course. So the materials and record should be available here in this section after each session. Okay, of course it's empty for now. Okay, so after our sessions, you will get the recorded material there. Any questions so far in this part? Hello, dear. Good evening. The sessions usually will be preparatory sessions will be around 2 hours, more or less. The revision sessions usually 3 to 4 hours. Okay, you're welcome. So this is, guys, your exam papers. That will be paper 1 and this is paper 2. In paper 1, that will be 50 single best answer and 50 EMQ. Okay, I know that this may be your first time to study EMQs. Okay, and the single best answer. What they do, okay, sometimes it could be paper 1 all obstetric and paper 2 all gynae, for example, or sometimes you will find that the single best answer are obstetric and the EMQs are for the gynae mix. Okay, so actually they don't have a rule for that. Each paper will take like 3 hours, okay, and you will have 1 hour break. Of course, your exam now is computer-based. This is way much better than before the paper. So the computer-based is very, very, very effective. The previous paper 1, it was really wasting time. Okay, so 1 second. Just want to show you examples of the single best answers. Okay, and for the EMQs, because also in the website you will see different, okay, form of the EMQs or the single best answers. This one used to be the EMQ, the old or the classic type of the EMQ, where there is a head of the question and there is after that scenarios, 1, 2, 3, 4, 5 scenarios, and here are the options and you have to select one of them. Okay, nowadays what they did, okay, in the last exams, they have different way or a different format of the EMQ. It's very similar to the single best answer. Okay, so let me show you one of these. Okay, so this is how the EMQ now comes. Okay, so it is options A, B, C, D, E, F, G, H, I, J, K. Okay, so it comes like a single best answer, but with longer option. Okay, with so many options are there. Okay, so this is how they now give you the EMQs. You will find 2 or 3 questions are related. okay, to each other, means it's under the same theme, okay, of the EMQ. Sometimes you will find there is a change, okay, in the in what's requested in the question. So careful, read every question as a new one, okay? Don't think that, okay, this one is related to the previous, here he wants me to do the initial step of management, then I will choose the initial step of management. No, careful, because it could be changed. What's required from you could be changed, okay? Even if they look similar to each other. The options here up to X, okay? Actually, in exam, you could get up to Q, okay? Sometimes it will be RST, yes. Something like that. 1, 2, 3, 4, 5, 6, 7. Yes, you can get 18 option or 20 option. Okay, so it is known and it's a fact that the MQ is most difficult type of questions. Okay, it is not like the single best answer. Why it will be difficult? Can anybody of you tell me idea why you think that EMQs are difficult?
Actually, I
Because you
find
will
them
have
very...
more than... Sorry, carry on.
No problem.
Okay, no problem.
Okay, go ahead, Dr. Mona.
Okay, for me, I find them very related to each other. Yeah, options are very similar. Maybe the change in arrangement or something like that.
Yes.
This is one part of the difficulty, and also a lot of options. A lot of options is not good.
Okay, that's sure. So thank you very much. So if I give you a question with 2 options only, so 50%, if you click here, it could be the right one, or you click here, it could be the right one. So even if you don't have the information, okay, you could get it right? So by increasing the option, they are reducing the possibility of you get it right by the chance, right? So that's why they think that the EMQ are more fair. But they have also some unique way, okay, of giving the options in the EMQ, which is they offer you one correct answer, right? In case if you have read the question correctly, like what? Look here, guys, because in the head of the question will make very big difference in the options. Here, for each woman, choose from the above option the most appropriate next step in the management. Okay, so next step in the management doesn't mean that this is the best thing in the management or the best option for her, right? Like, for example, you have a lady presented to you, okay, with shortness of breath and signs or symptoms show that she had pneumonia, okay, fever, and she had pneumonia. So you think that the most appropriate treatment for her is to give her antibiotic, right? Is it correct? So the lady had fever, she had chest infection, she needed an antibiotic, okay, right? So you think that this is the answer, while because he had mentioned here most appropriate next step in the management, so next step in the management could be give her oxygen, right? Or request chest x-ray according to what's written there, right? So guys, that means if the answer there, okay, the right answer there, like as I told you, offer oxygen, this will be your choice based on the question most appropriate next, right? Okay. What if you didn't read that and you thought that he wants you to choose the treatment, the appropriate treatment? Okay. And then you jump to the antibiotic. Do you think the option of the antibiotic will be there? No, it will be there. For the MQ, it will be there. They put the answers based on the possibility because they know well how the candidates think. They have their own way of analysis and they have experience. Okay, so they put different answers that it work, okay, in all the different ways. Like for example, I tell you, okay, like for example, okay, I'm speaking about a woman who comes with shortness of breath, signs and symptoms suggestive of pulmonary embolism, okay, but this lady, she had X-ray and the X-ray is still there, okay, and then he still, you didn't know what is the result that came in the X-ray, you didn't see the X-ray yet, so he will ask you what is the next investigation, and everyone know that when you have the chest X-ray abnormal, then the next investigation will be what's called CTPA, okay, or if the CTA, if the chest X-ray comes normal, then the next step will be the VQ scan, okay? But he mentioned something that this woman, okay, had a family history of breast cancer, okay, in the details. So if he added the woman had family history of breast cancer, so what will be your answer now? You think that the family history of breast cancer will make a change in your answer?
Yeah.
Okay, so what? Okay, so you will avoid in this case what?
CTPA.
Okay, so you will avoid it because you have the information that the woman had the family history of breast cancer, right? Okay, so this is how they give you the question. One question, like for example, comes in January and there is no family history of breast cancer, okay? Then the options are there to do either CTBA or VQ based on the X-ray. So everyone will go to this because this is the correct answer, okay? Then in July, the same year, they give the same question, but they just add the family history of breast cancer. So because he added this information, this piece of information to the MQ, now the answer is changed, okay? So in the option, you will find CTPA or VQ based on the X-ray result. What do you think? Or the next option will be CTBA, or the third option will be VQ, okay? So what do you think most of the candidates will do?
VQ.
Most of the candidates, unfortunately, they will go to CTBA or VQ based on the X-ray. You know why? You know why they have fallen in this trap?
Because this
Because
is the traditional,
As
or
it's
this
been
is
in
the
the
basis.
previous exam.
yes, because they have a preset mind before the exam. They know the recall and they know that this is the answer. So they will go without reading the question properly. Okay, I know this is the answer, CTBA or VQ based on the X-ray. While there is a trap in the question, right? So the college know that there is some candidates have read the recalls, and actually members of the college are, now found on the social media, Facebook, Telegram, and they know what we do, okay? And they know that all the students now have the recalls. They know that, okay? And they know the nature, okay, of the people who are just jumping and running to the answer without reading properly the question. That's why they put some bombs, okay, some traps in the question, in the MQ, and people just fill into it. You know, things will be very easy if he didn't put this option, right? But no, he doesn't want it to be easy. He wants to select the best of the candidate. Okay, so you are all good, but they want the best of the best from you. Okay, so they give you all the possible answers, to all the possible mistakes, okay? And only the well-trained candidate, okay, will choose the correct answer. That's why it's challenging, and that's why it's tricky. Okay, so this is how they play the MRCOG. Or sometimes they will give you some, you know, British people, they are very accurate and very precise as well. They want to, when you say something, to be clear about it. So for example, if you want to do something, okay, you say, I will do it, right? Right? If you are not sure if you will do it or not, you will say, I may do it, right? Or if you could do it, okay, if you have the ability to do it, but you're not certain you would do it or not, you would say, I could do it, right? Right? Or if you are offering something, like you volunteer to do something, then you say, I would do it, right? So there is different between each and every word of these. If it is obligation by the law, it would be, I must do it, right? So this is how also they play with word in the exam. And this is not specific for the RCOG exam. This is in all British exam, okay? They want you to be clear about what you're going to do. In a case where they give you offer treatment for something, okay, when the level of recommendation is offer, this is different from consider, right? So in exam, we give you, for example, a woman who has HIV infection and her viral load at the 36 weeks was 200, okay? What is there in the recommendation by the guideline? In the recommendation by the guideline, they say, if less than 50, okay, then vaginal delivery is safe, okay? If it is between 50 and 399, then consider the cesarean section, okay? And then if the viral load 400 or more, then recommend or offer cesarean section, and vaginal delivery is not recommended in this case. Okay, and in the options, he will give you this case who had 200 viral load. Okay, so that now she's in between. If you say that cesarean section is recommended, this will be a wrong answer. Okay, because what's came in the guidelines, cesarean section is considered, right? So you have to choose the correct choice according to what is said, and not all the words are similar in strengths of recommendation. Okay, so there is difficulty, or there is different in the strength of recommendation. Then you have to be sure when you choose that you are choosing the correct answer. Okay, so the way of the college is that they give you one correct answer plus 3 at least in the MRCOG that can work, but you have to choose the best according to the situation, according to what's requested from you. So because now you know about the exam, and you know that the MRCOG carried the highest mark, okay, so even the 50 of the single best answer are not equal to the 50 of the MRCOG. The MRCOG carries 60% of the mark, okay. The single best answer carries only 40%, okay. And what else? They could even give more marks to the MRCOG than the single best answer according to the difficulty of the questions. That's mean if you answer the MRCOGs wrong, okay, no way you will pass the exam. If you give poor answers in the MRCOG, you should have a good technique in answering of the MRCOG. Single best answer question, mostly based on you know the information or you don't know it. Okay. But MRCOG, it's about the deep understanding of the game. If you can play the game according to the rule or not. Okay, so that's mean in the stages of your preparation for the MRCOG, part 2, reading is not enough. Is it correct? You think that reading for part 2 exam will make you pass? No. If I say, and I always say that, this is the result, okay? So this is the pass result of you. In order to reach to this point of pass, you will need to finish 3 stages of preparation. Stage number 1 is reading the guideline. Okay, so look here. Even reading the guideline make you made like 50% of stage 1. You may also summarize the guideline by yourself. Some candidates, they are really comfortable of doing that. That's okay. If you want to do your own summary and you have the time, okay, why not? If you don't have time, then also no problem. Okay. Previous records of the September course, did I tell you about it? Yes. So the previous records is going to help you in the reading, right? At least it can guide you what to read. So this is all stage 1 of preparation. So you're doing all this effort and you're still stage 1? Yes. If there is a possibility that you can pass this exam by only stage 1, by completing stage 1 only? No way. I'm so sorry to say that. Whatever your reading is, whatever I would say, records or session you're listening to is, okay, this is not enough. Not enough at all. You are in the first third of the way. Then you'll be ready to stage 2 of preparation after you completed this part. What is stage 2 of preparation? This is when you attend the live sessions, okay? Make notes, ask question, clear confusion, okay? When you know the material, revise the material, okay? And when you start solving questions, this is the stage 2 of the preparation. Okay, so that's mean by participating in the course, you do your job in reading the materials and you attend the live session and you solve some questions. This is you completed the stage 1 and the stage 3. Okay, is that enough to pass the exam? This is maybe plus or minus. I'm really saying that and I'm honest in that. This is plus or minus. Maybe you pass, maybe not. I'm not sure. Okay, then how to pass and how to be ready? You will be ready only if you are here in stage 3. Okay, stage 3, that's mean you are doing questions only. Okay, you have studied, you have finished preparation, and now you are ready to solve the questions only. Okay, so more and more of questions, you will solve books, recalls, and mock exams from the websites. Okay, guys, so when you completed this stage 3, definitely you will pass. No way you can't pass. Okay, so be honest with yourself in your preparation. At what stage you are? Is it stage 1, 2, or 3? Okay, so I expect most of the people attending a longer preparatory course will be between stage 1 and stage 2, right? Maybe they have completed stage 1, maybe not. okay? And they are ready for stage 2, which is in the course. Okay, guys, so this is the stages of the preparation. Make sure, okay, that you solve with more question books and records and mock exams before you go. Those are very important and mandatory, okay, for the preparation. So look here, stage 1, this is all about books and reading, notes, and so many papers are there. Stage 2 is processing what you have read, okay? And stage 3 is solving questions only. Then how the course is designed to take you through all the stages. As I told you, I helped with the material, with the reading beforehand, so you can go through them, prepare accordingly, okay? And so you will get the best benefit of the live session. Now, we will look to the course times. Next session will be the surgery module. This will be on Wednesday. Then on Friday, we will have the post-operative module. And then next week, we will have the cervical screening. And then we will have the ovarian cyst and endometrial hyperplasia. Okay. If you ask me about those topics and which one is very important, which one is very easy, and so on, I would say that surgery module is a quite easy module. Okay. Post-operative also is a quite easy one. It's also very helpful in practice. Cervical screening is a little bit confusing. Okay. And ovarian cyst and endometrial hyperplasia is the same, but they are here, the ovarian cyst and endometrial hyperplasia, one of the highest quality or the top topics for the exam. Ovarian cyst and endometrial hyperplasia, and with each topic I'm saying, okay, which topic carry high mark in the exam. So make sure that topic like the ovarian cyst and endometrial hyperplasia is really, 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 okay, prepared very well before you go to your exam. Then cancer staging and recommended treatment, little bit of sophisticated or difficult questions in the exam are, you know, known questions, okay, and we are going to solve them together and solve like mock test on them, so it will be easy for you. Urogynecology, it's an easy module for me, okay. Sexually transmitted disease, easy as well. Contraception, easy. Gynecological problem, the most important one of them is the heavy menstrual bleeding, okay, but anyway, the other topics are easy. Heavy menstrual bleeding is a little bit confusing, but other topics are easy. Subfertility is okay, moderate topic, and for the exams, they always ask about the male subfertility, okay, so no many questions come from this module. Then we will have our revision. Then we will have the early pregnancy complications, and the early pregnancy is highly scoring topics. Okay, so very important for the exam. And then we will go to the rest of the obstetric rounds. Okay, and we should be able to go through the obstetric. Maternal medicine is really long modules, okay, very long topics are there, infections as well, management of labor, okay. And finally, we will have in March teaching method and workplace assessment, clinical governance, and legal problems. This is like tough topics, okay, but it will be good to be done at this stage. For 6 weeks, we will have off from the course, okay? So from 27th of March, that will be the last session of statistics, okay? Then we will have 6 weeks off. Then we will come again in May, okay, for the final revision. You should be finished with stage 2 of your preparation in March, okay? So guys, in March, you will be, by the end of March, you will be here in stage 2. Then I know that the majority of the group are Muslims. Okay, so you will have Ramadan. So no study at Ramadan, no course, I mean, but you can study, you can revise. Then we will meet again, okay, in the last 6 weeks before exam. In the last 6 weeks before exam, we will have extensive mock solving, okay? So we will solve recalls and mock exams together to make you ready for the exam and to make sure that you all are here in stage 3 of your preparation. This is my intent to the course, okay? The course plan of studying and giving you more time to read and more time to absorb the knowledge, more time to study, more time, to revise again and again. So at least by this way, you will have 3 times, okay, revision and the study of the whole material and the whole curriculum for part 2. And also will make sure that you have every topic covered, every question covered, every recall covered, okay? So hopefully that all of you follow the group in the study plan. And I don't want I know in the ways of preparation, there will be like ups and downs. Okay, sometimes you feel like, no, I don't want to study anymore. Okay, or I get bored from that. This is a long journey of preparation, but the aim of having the MRCOG is really worthy. Okay, and we are here all together, so you can celebrate the success together as well. Every time when we end the journey, we have really our results come out, and this is make us very proud, really very proud of our candidate. And this makes things easy for me as well, because I really, give so much time and effort in the courses to reach this moment, the moment of celebration of your result.